President Akufo-Addo is on a tour at 2 hospitals designated as coronavirus centers here in Accra. This follows a report by the World Health Organization that identified gaps to plan for preparedness, response and control activities in the West African country, which is Ghana. The president also has been cut short his visit to Europe in response to the spread of the deadly disease. He's been touring the Kotoka International Airport to ascertain for himself the preparedness of officials there and the screening process they are employing.
Yes, yes. And then we also have telephone telephone numbers for the passengers and their contact person. Any other person who can be contacted should they be needed. So we hope that that will take
an exhaustive system.
Yes, sir.
And we started encouraging the long-haul buses in country.
Yes.
To also pick in passenger data in terms of addresses and telephones, so that whoever is going on OA to Kumasi or Tamale, the bus VIP people should pick all the passengers in there. So in case we get just one somewhere, we'll know who they contacted and we can go track them. Thank you, boss. Microphone now.
As President Akufo-Addo there, who is touring the airport, checking out for Ghana's preparedness to make sure that nobody with the disease, for example, enters into that country. Well, apologies there for how the camera's movement has been. Indeed, usually on tours like this, it gets a bit hectic. We can hear what they're telling the president now.
To make sure that we don't get people bumped together is to sometimes delay flights. So a flight may land and we may call them. And we use the health ministry to achieve that because...
So that you can evacuate the before another land.
So there was an issue this morning where we had to delay a flight 30 minutes and they were complaining, but we told them that we have to do it for the safety of the industry, and so they complied.
Safety before everything else.
More briefing. The president is receiving there. As you saw, he's been flanked by the immigration boss, Kwame Esuatechi. He also has the health minister, Kwajima Menu, and some other health officials talking to him. Hopefully be connecting to Elton Brobe, who is traveling with the president on this particular tour. For Elton to tell us, what has the president been saying? What are his impressions on our preparedness and our protocols at the airport? Indeed, last time I hosted here a Chinese journalist who flew in from Kenya. We spoke to her about her thoughts of what is done at the airport when you enter. From her perspective, it's not as rigorous as she would have expected it to be. She reported about people who had their masks not worn properly, which obviously doesn't work from her perspective. But President Akufo-Addo himself is ascertaining what our protocols are. He himself has flown from some 3 countries, the United Kingdom. He was in Norway. He was in Switzerland, where indeed cases have been recorded. He, we're told, subjected himself to the thermal trials there to be sure that his temperature is okay as part of the checks for persons with coronavirus. And he's been taken about on this tour by health professionals, by the health minister himself, and of course, the immigration boss. We'll be connecting, like I said, with Elton. President Akufo-Addo, we understand, has already made his way off from the airport to the Ridge Hospital, or the Greater Accra Hospital, where he's been inspecting their own preparedness there. We'll come back to Accra and go to the Ridge Hospital, where President Akufo-Addo has just finished his tour there, where Elton will join us with details. But let's go to Kumasi in the Ashanti region as we stay longer on this story. Well, there seems to be growing concern among residents over a man who they fear died due to untreated COVID-19 in his system. This is even after health officials dismissed the rumors after a test proved negative. But the Ghana Health Service is holding its annual review meeting in Kumasi today, and my colleague Ohime Interior is sitting through.
Marco Boateng points out health workers will be acting in vain if the public remain apathetic.
We are entering uncharted territories, and we need measures as a country to all come together. These are military issues, or you know, these kind of emergency. It's not for kids. All of us should come together and decide. The universities will be thinking. Everybody will be thinking. Sports will be thinking. Our football, lecturers, churches, mosque, funeral. Everybody will be affected.
Chinese businessman identified only as David reportedly returned last week from Guangzhou, about 980 kilometers from the Wuhan epicenter of coronavirus, and is on self-quarantined. It comes in the wake of first confirmed case in Nigeria, Algeria and Egypt. Dr. Dumako Boateng describes self-quarantine as one of the best measures for people who have been exposed to the disease. He advised people with influenza and common cold to isolate themselves as well.
We have really what we call case definition, and this is what people should know, so that we don't go into that panic state whereby we are sitting on an edge, and if you are not careful. So we all will have to come together. When do we apply this? It's more technical. When do people go into self-quarantine? Somebody is coming from maybe Italy, coming from South. This is not related. So these are things that we all will have to piece together. But for example, if you know that you are exposed, and how many of us are really in that kind of literacy, where you know you are exposed, you give your number, you go even to your house, you have to make sure that your wife and kids don't come. Where self-quarantine means that I'm going to stay in my house and exposed to my family. So all these things will have to come out for all of us to take that decision. But it comes to a lot of criteria. And then if you meet them, then, self-quarantine is one of the ways.
Dr. Dumako Boateng endorses calls for people to refrain from handshake as well as adopt self-protective measures.
The best way I have to cough is this is what I do. Everything basically have gone into there. And the moment I do that, the droplet doesn't fall on any surface here. Mind you, imagine I have been coughing on this and you have touched. it means that you have picked it. So if you are coughing, you cough, and mind you, even if you are going to use your handkerchief, because the moment you use your handkerchief to cough and touch it yourself, you have still infected your hand. If I shake somebody's hand, I assume the person is infected. It means that you have to do what? Wash your hands well with soap and running water or hand sanitizer. You do that. And as we are also discussing, what prevents us as a society coming together and saying, look, we are in serious time, we are in desperate seasons, and desperate measures are supposed to put in place. Please, we shouldn't shake hands. I mean, if you don't leave, how can you enjoy your culture? you live to celebrate your culture, your tradition, and social. But if you are not there, so we will begin then to think about how do we do that. Shaking hands, which is so social. Why can't we hold on? And all of us will agree. Why don't we do elbow to elbow? Why don't we do leg to leg as in the WhatsApp media? At social gatherings, one, as much as possible, we stop the hugs, we stop the handshakes.
From Kumasi for Joy News, Parliamentary reporting.
Let's go to Elton Brobe, who joins us from the Ridge Hospital, where President Akufo-Addo has just finished checking. He'll tell us more, starting from the airport. Hello, Elton.
Yes, Vicky.
Elton, tell us what happened at the airport on President Akufo-Addo's checks.
Right, so the first port of call was the Terminal 3 of the Kotoka International Airport, where President Akufo-Addo inspected our preparedness in terms of dealing with people who come into our country because of the global threat that the coronavirus is posing to the whole world. Now, at the standing area, President Akufo-Addo, who went on a European tour, subjected himself to some kind of a screening. The rules that they put in place to ensure that people who come in conform. The rules that they've put in place to ensure that people who come in conform to an acceptable temperature level before you are allowed into the country. He was briefed on the country's preparedness. He was briefed by the Chief Executive Officer of the Ghana Airport Company, who says that so far only 2 persons were quarantined because they showed signs of the coronavirus. They were later taken to the Ridge Hospital, but the test came out negative. So as far as Kotoka International Airport is concerned, they are in readiness to ensure that anybody who comes into the country goes through what they've laid down as procedure. And so far, they've complied with it. President Akufo-Addo was excited about what he saw, impressed with it, and then said that he hopes they'll continue to ensure that anybody who comes in and reports symptoms of what has been identified as common, features of the virus are taken out and then dealt with according to the laid down rules. From the airport, the next port of call was the Ridge Hospital, which has been designated as one of the holding centers in the event that we record a case. Now, they have an infectious disease center, which they have designated as place that will hold people who may show symptoms of this virus. So far, they have 4 beds to take care of people who have come in. The Chief Executive Officer of the Ridge Hospital, Dr. Emmanuel Shefrenyo, tested that so far they've tested 17 people, and all those tests came out negative. However, they recorded a case yesterday. The samples have been taken, and they have taken it to the Noguchi Medical Center. They are waiting for the results of this test. Now, this patient, according to him, is an airline operator who is currently being housed at the Ghana-Canada Health Facility somewhere around East Legon. They are waiting for the test results to come in, and then they can establish whether a negative or a positive case. But out of the 17 they've tested so far, all came out negative. I asked him whether they have all the resources that they need to contain the virus in the event of an outbreak. And he says that so far, the center they have can only take care of 4 patients. They are hoping that they can expand it so that they will be in full preparedness to deal with some of these things. The concern or the challenge they are facing is that people who come out of the country and they experience flu or any symptom that has been identified as some of the symptoms of coronavirus, they've been trooping into the hospital and, you know, voluntarily asking them that they be tested. And that is a challenge for them because, according to him, the test is very expensive. And because of the importance the country attaches to this particular issue, they are not charging people for the test. But if they have to expend their resources to test people who come in voluntarily, then it will put a strain on their financial resources. For now, President Akufo-Addo, after inspecting the facility, told us that he's impressed. All fingers crossed, those were his exact words, all fingers crossed, and hoping that we will not get to a stage where we'll record cases. On Friday, at the Independence celebration in Kumasi, we hope to touch more on this particular issue. Before we left the Ridge Hospital, the health minister told us that he was going to address a news conference to update the country on what they've done so far, the cases that they have tested, and going forward, what they will be doing to ensure that the country stays safe as far as the coronavirus is concerned. Gifty.
Well, that's a press conference that we will be covering. We'll be taking live here as well. But Elton, I'm just interested in what you said about the 17 suspected cases. These are all cases recorded at the Ridge Hospital?
Exactly. These are cases recorded at the Ridge Hospital, 17 so far. Indeed, if you want to add the one they are waiting the results to come in, that will be 18. But the 17 they recorded at the Ridge Hospital, the tests conducted on all of the 17 came out negative. And these are people who came with symptoms of the coronavirus. So they quarantined them, they subjected them to the test process, and all the 17, turned out negative. Now, what they are waiting to see is the 18th case, which is currently before Noguchi. The patient I asked them about, according to the chief executive, this patient is an airline operator who came in last night, currently at the Ghana Canada Hospital at East Legon. If the tests turn out to be positive, they will move the patient to the next stage of the containment process. And so we are all waiting to hear the outcome of that case from the Noguchi Medical Center.
No, did they explain to the president what steps they are taking after this suspected case, which is still, being tested? Did they explain to the president what steps they are taking? Is this person in a controlled area? Did they say anything?
Well, the 18th case that they are dealing with, according to him, is no different from the ones they've done so far, from the 1st to the 17th, that all came out negative. And because it's their protocol, they have to just follow it. So the outcome will determine what step they take next. But but according to him, at the Ghana Canada Hospital where this person is being held, the person is in an isolation ward, which means that he has no contact with people who are at the hospital, and health officers who are also working around him. They don't want to take any chances outcome. They've taken these preemptive measures while they wait for the outcome of the case file they've submitted to the Gucci Medical Center. Gifty.
Elton, thank you very much for that update. Elton Brobe there, joining us from the Jubilee House, live from the Jubilee House. He's been following President Akufo-Addo, who has been checking our protocols at the Kotoka International Airport. The president also went to Ridge, which is one of the designated holding areas should anybody be suspected to be having coronavirus. He talks about the fact that at the Ridge Hospital alone, they said they've recorded about 17 suspected cases, 18 to be specific, because there's one more that happened today and they're still testing. The samples have been taken to Noguchi and the tests are still ongoing. So we're waiting to find out what that result is. You do also know, we told you about the story in Kumasi where a suspected case, health authorities say tested negative, but the person ended up dead. Well, the cause of death has not been explained, but we're told that another test is ongoing to ascertain what actually happened in the case of that death. We're not sure about what it is yet, but 17 cases so far at the Ridge Hospital. They have space for only 4. To wait, they can only take 4 human beings should there be any sort of outbreak. President Akufo-Addo has been checking that. They're talking about the need for expansion. He went to the airport where we're told that he subjected himself to that temperature checks as well. And they explained to him the protocols. But what we ought to know and the information that needs to come from the Ghana Health Service is whether or not we've reviewed our position as far as quarantine measures are concerned. If you recall, the Ghana Health Service indicated sometime about 2 weeks ago, that they will be subjecting persons who fly into the country from the Hubei province to 14 days quarantine. Now, we're told that from Elton's report that only 2 people so far have been quarantined. But of course, those people have been let go because they were only suspected to have had the virus. It looks as if they were satisfied. Officials there were satisfied they did not have it, and so they let them go. What we don't know is whether we've reviewed that quarantine policy to include other countries, other flights or flights coming from other countries, especially from Europe, because we know the situation in Italy is getting worse. A lot more people have been infected there in Italy. We know that Germany has reported a lot more cases, and we'll take you to Germany subsequently here on the show, so you have an idea of what the case is in Germany on our usual crossover right now. In the meantime, like I said, Health Minister Kweku Agyeman-Manu is assuring Parliament that government is doing everything possible to protect Ghanaians from coronavirus. This is the second time within 2 weeks that the minister is briefing Parliament over its preparedness, or the country's preparedness to deal with the coronavirus outbreak. Health officials are holding a press conference where head of our health desk, Fred Smith, is standing by for us. As and when they start, we'll go there. But we can hear from the health minister. Well, that press conference is still, they're preparing to bring us that press conference. But let's get on the phone to speak to Joseph Opoku-Gakpo, our Parliamentary Affairs correspondent, who was there when the minister came around. Hello, Joseph.
Hello, Gishi.
Tell us what the minister has been telling Parliament.
He's been giving a number of assurances, including pointing to how come more than 500 protective equipment have been brought in and distributed. He says training programs are ongoing for healthcare personnel at the very front line when it comes to helping deal with healthcare situations. He's also indicated that when it comes to centers for the necessary quarantine of people who may be suspected of having the disease, there's been the situation of a facility that's coming up that's up to 100-bed capacity. And he says, in his words, the government of Ghana will do everything possible to ensure that Ghanaians don't suffer from any possible outbreak of the disease in the country.
Joseph, I'm wondering if any of the members of Parliament, especially those on the Health Committee, brought up the issue about the Ridge Hospital, which is one of the designated areas to hold persons suspected to have coronavirus. But they can only take 4 people, we're told. Did this come up in Parliament?
Specifically, Ridge Hospital and the number, no, that didn't come up, except that the ranking member on the Committee on Health, Kobna Minta Kando, made a broad claim that he thinks the country is generally not ready. He says that an amount of 35 million Ghana cedis is what was expected to have been released in terms of managing the possible outbreak, but only 2.5 million Ghana cedis has actually been released, which he says is completely out of place. But in the course of that, he got a rebuttal from another member of the Health Committee, Dr. Bernard Okoboy, who is the MP for Lejokuku, who made a point that with Ghana's preparedness, it's virtually the best that you can see compared to different parts of the world. He makes the point that the disease in question is actually to a certain extent being overblown in terms of its possible transmission, because he says that this is a disease that out of every 100 people, only about 2 people who get infected out of 100 are dying. So it has a rate of mortality just around 2%. But other diseases, including SARS and other ones, which are quite common, have even higher rates of mortality, and more attention is not being paid to those. So he thinks Ghana is very much prepared and the situation is very much under control.
Well, apart from the minority spokesperson who put in this intervention, what was the general feedback that he got from Parliament?
The leadership of the House, including both the majority and the minority leaders, made the point that they think the healthcare sector is a very key area that the necessary resources should be pumped into, and that there is a need for government to ensure that all necessary measures are put in place to avert any possible breakout of the disease in the country. So from the House broadly at the level of leadership, they made the point that the expectation is that the preparation and preventive measures will be upped and ensure that the resources are made available and that Parliament should be constantly updated. And if there are any challenges that the Health Minister thinks would require the intervention of the House, he should make sure he brings it to their attention so they can help him prosecute the broad agenda of protecting the country.
Brief us, Gakpo, on what else was on business of Parliament today. This
was the main item that the House dealt with. We're expecting the Minister for Land and Natural Resources, to come respond to questions on what is being done to better enforce the rosewood harvesting ban. He was on the floor, but it's unclear how come that question was actually deferred and it was never answered. The House has been dealing with the Narcotics Commission bill, which they are working to get amended, and that's still ongoing. But additionally, outside Parliament, I've been engaging the ranking member on the Defense and Interior Committee of Parliament, James Agalga, on yesterday's request by the Deputy Attorney General, Godfrey Dame, that President Mahama stepped up and have discussions on the issue having to do with the airbag scandal. And in the words of James Agalga, the comment by the Deputy Attorney General are reckless, it's unacceptable, and he thinks that it's an interference in the work of the Office of the Special Prosecutor, and that shouldn't be done under any circumstance.
Joseph, thank you very much for that update. Joseph Opoku Gakpo reporting for us from Parliament, where he indicates that the Health Minister was there briefing the House on what the ministry is doing to protect you and I from coronavirus. Like I said, health authorities are holding a press conference this afternoon on coronavirus. We are live there. It's almost starting. We'll take you there so you have an idea what's happening. But so far, the story we have told is that President Akufo-Addo has been inspecting airport protocols, checking against the possible entrance of persons with coronavirus. And also, we know that he's been subjecting himself to some of these checks. But there are just a few things that you can do to keep yourself protected. Now, what you can do is to consistently wash your hands every now and then, consistently use sanitizers if you can. What are some of the signs that you should be alarmed when you see? There is coughing, there is sneezing, and there is difficulty in breathing. So if you have any difficulty in breathing, you are coughing, you are sneezing, you want to report yourself to authorities, or sometimes you may want to have that checked. Also, what you can do to protect yourself is anytime you use a handkerchief, you need to cough, you need to cover your mouth with a handkerchief. And in that handkerchief, you need to, after you have coughed in that handkerchief, you need to, if it's either it's a handkerchief or a tissue, you need to dispose it off immediately. You had the doctor speak to him in Teria, who said that even if you use a handkerchief and you cough into it, it has some of the particles from your cough, and you touch it later, you could still have it. So you ought to be very careful. I'll give you an idea of what the situation of coronavirus globally is at the moment. Several thousands of people have died. At least over 3,000 people have died. So let's go to the board now. Let me take you through what we have here. So far, we're looking at a totally confirmed cases of 94,250. That's the total number of confirmed cases worldwide. How many people have died? 3,214 human beings have died globally. And if you look at the total number of people who have recovered, you're looking at 51,026. So even though coronavirus falls in the family of SARS, H1N1 flu, etc., the fatality rate with coronavirus is relatively lower than it is with SARS and the others that fall within the same family. Now, if we look at mainland China, it looks like the cases have not been, soaring as they did at the beginning. So let's see mainland China. It gives you an idea how widespread the disease is. If you look at where the red button is, it tells you how widespread the disease is. Actually, that is Asia. So it's covering almost all of Asia. If you take a look at take a look at the map, in mainland China alone, the number of total confirmed cases is 80,270. That's 80,270. But 49,940 have been treated, and those people we understand have been have recovered. Now, if you go to China, we're looking at the Hubei, which is the epicenter, of course, where Wuhan is. There's Henan, Heilongjiang, there is Beijing, there is Guangdong, there is Anhui, there is Chongqing, Hebei. And so it gives you a list of the places where people have been infected. And then it gives you also a list of people who have totally recovered. So this is what China looks like. There it is, the red spots, where you have all of the red spots with China. That is where China is. Well, let's go to Germany, for example, because we'll take you there live very soon, where we talk to political correspondent with our partners, the DW, on what is happening there in Germany. Well, we're looking at 244 cases. Remember, Germany started with just about 4 cases somewhere last month. It's actually less than a month ago since they recorded those 4 cases, and already 244 cases have been recorded. So far, fortunately for Germany, nobody has died. But 16 out of the 244, only 16 have been able to recover from this disease. We'll go to Germany and tell you how authorities there are dealing with this situation. Well, let's check out what's happening in France, also in Europe, and subsequently we'll take a look at Italy, one of the interesting cases as well. But in France, we're looking at 212 cases. 4 people have died in France and 12 people have recovered. What's happening in Italy? In Italy started with somewhere last week with about 4 people being infected. Right now, we're looking at 2,502 cases recorded in Italy alone. Now, if you look at Italy, it has become an epicenter of the virus in this part of Europe. So, 79 people have died so far. Out of these 2,502 people, there's only 160 people who have recovered, but 2,502 already. Let's move all the way down and see what's happening in Africa. In countries, you know, in Africa, we do know that yesterday, is it Tunisia and Senegal recorded some cases as well. Well, in Nigeria, there was 1 confirmed case. Now, this is very interesting because if you record Nigeria's response to this, it's been good, because so far we haven't had any escalation from that one recorded more than a couple of days ago. So far, only 1 confirmed case. Nobody has died, nobody has recovered, meaning that the person who was infected is still with the infection in Nigeria. Well, what's happening in Tunisia? Let's take a look at what's happening in Tunisia. 1 case confirmed in Tunisia. So, just like what's happening in Nigeria, 1 case has been confirmed, no deaths, nobody has recovered, meaning that the person who was who confirmed or who tested positive to coronavirus still has the virus. Hopefully, they'll find a way of dealing with that. What is happening in well, let's see, there's so many countries here, and I'm just Saudi Arabia is an interesting case. In Saudi Arabia, even before the coronavirus got there, authorities cancelled the annual pilgrimage. They cancelled it because of the sheer number of people who go there on a religious journey. You know, they go to Mecca, but we understand that authorities there cancelled that trip, and that's very unusual. This, we understand, has not happened in a very, very, very long time. As far as anybody else can't remember. But one totally confirmed case there right now. Nobody has died. Nobody has recovered as yet. But that's the story of Saudi Arabia. Let's take a look at Senegal in Africa. Again, Senegal, as you can see, has one case. It is surrounded, by the way, by all of these countries that you see here. So there's the need to contain this disease. 2 persons confirmed with the disease. None of them has died. None of them has recovered. So 2 cases in Senegal. Well, let's take a look at other countries. What is happening, for example, in Mexico? Mexico was one of the countries that was, if you like, a laggard, because even though there were cases in the United States of America, Mexico sounded fairly safe. Now we know that even that country has also recorded 5 cases. 5 cases. Only 1 out of that 5 cases has recovered. Nobody has died as yet, which is a good thing. But it looks as if sporting activities there have also been put on hold. Let's look at Finland, where President Akufo-Addo returned from not so long ago. Finland. In Finland, we're looking at 6 confirmed cases. Now, mind you, think about last week, early this week, there was just about 1 confirmed case in Finland. Just a few days, and we're looking at 6 confirmed cases. 1 of them has recovered, but nobody has died as yet. In Greece, where they are preventing Syrian refugees from entering, what is happening in that country as well? 8 confirmed cases. Nobody has died as yet, and nobody has recovered. That is Greece. And the story to Greece is that, well, migrants from Syria are still looking to enter, but there is a strict policy there. They've closed their borders to these people. Well, that is what's happening as far as coronavirus is concerned. 8 cases confirmed there. Well, in Denmark is looking at about 10 cases. And I'm just picking and choosing from these countries anyone that catches my attention. So we'll look at Denmark. Denmark has 10 confirmed cases. Now, what it means here is that nobody has recovered. So the 10 people who have been confirmed are still living with the infection in Denmark. Well, let's move up a bit and look at the countries with more numbers right now. Look at Canada. Canada has recorded so far 33 cases. After Canada, we'll take a look at the United States of America. Now, United States of America has put their vice president in charge of coordinating efforts against coronavirus. And apart from that, they've committed some $2.5 billion to dealing with this disease. That's the United States of America. And their state agencies are working, they're working hard to make sure that this doesn't go. But they've recorded pretty interesting cases. A case of somebody who has no travel record, but who was also infected. That person, we understand, has died, and they're still investigating. So every day here on the show, we give you an idea about the rate of spread of coronavirus across the globe. Hopefully, it gives you an idea what is happening so you can keep yourself protected.